Before we understand what is insulin resistance, we should understand how does insulin work in our body. Let me explain this very simply to you. Consider you are eating food. Of course, the food reaches the stomach and gets digested there. And from your stomach and intestine, the glucose gets absorbed into your bloodstream. Now consider this is your bloodstream. Glucose is been passing in your bloodstream. Now this glucose has to enter into your cell to get converted into energy, which we call as ATP. Now for the purpose of this glucose to enter the stomach, insulin has to act like a key to open the door for this cell to open so that the glucose can enter into the cell for energy production. So what is the role of insulin here? The role of insulin is to act like a key to open the lock so that the door opens in your cell and the glucose can enter into your cell. So having understood so much, what happens in insulin resistance is, in insulin resistance, both lock and the key are present, but the lock becomes less responsive for this key. And automatically what happens is the key or the insulin will not be able to open the door so that the glucose can enter inside. As a result, what happens? More glucose will be passing in your bloodstream, increasing the level of blood sugar, which we call as diabetes, or to be more precise, type 2 diabetes. In the early stages, our beautiful body will try to compensate this by producing more insulin from the pancreas. But slowly and gradually, over a period of time, you will start to notice that your blood sugar level slowly starting to climb up, and of course resulting in type 2 diabetes, as I just mentioned. Now, this insulin resistance or type 2 diabetes is not something that happens over days or months. It happens over a period of many years. And before the diabetes appear, there are many signs that your body will show. And that is exactly what we are going to discuss in this video. So in this video, I'll explain you 7 warning signs that your body is showing if you are having insulin resistance. Also, towards the end of the video, I'll explain you what are the tests that you should do to get this diagnosed. And of course, what you can do to prevent or make your condition better if at all you are having any signs that you are going to discuss. The first sign that your body will show if you are having insulin resistance is increasing fat around your waist. This is where many people get frustrated. They say, "Doctor, I don't eat a lot, but my belly fat is growing day by day." Now, of course, calories matter, but belly fat is not only about eating more calories. The thing that you should understand here is insulin is also a storage hormone. When insulin level stays high for a long time, the body becomes more likely to store energy, especially around the abdomen. And the thing that makes things worse is belly fat can make insulin resistance even worse. So they act like a cycle. Belly fat can lead to insulin resistance, and insulin resistance can lead to deposition of belly fat, and the cycle just goes on. That is why waist size is much more important than just body weight. The second sign is something we all face: tiredness after meals, especially after rice, bread, sweets, sugary drinks, or a large carbohydrate heavy meal. Of course, food is to give energy, but as we discussed in the introduction, in a condition like insulin resistance, your cell becomes less responsive to insulin, the key, and the glucose will not be able to enter the cell. Only if the glucose enters the cell, the energy production can happen. And as a result, what happens? Even if you eat a lot, more glucose is present in the blood, less gets into the cell, leaving you feel tired. And now don't take me wrong, feeling sleepy after a very heavy meal once in a while can happen, and that is quite normal. But if this happens frequently, especially with belly fat, cravings, or constant hunger, it is worth paying attention. The third sign I want to mention is feeling hungry too often. You eat a meal, but soon after eating, you feel hungry again. Or you specifically crave sweets, biscuits, tea with sugar, chocolate, or refined carbs. And why does this happen? Again, the same reason. There might be enough or even excess glucose in your blood, but your cells are not using it efficiently. As a result, your body will keep asking for more energy. This can create cravings, snacking, and constant hunger. And I have seen many people blaming themselves for not having willpower. But sometimes it's not about willpower. It's about your metabolism asking for help. The next one is a little important one. A visible sign that many people ignore is dark, velvety skin around the neck, underarms, or skin folds. In medical terms, this is called as Acanthosis Nigricans. It is usually associated with insulin resistance or high insulin levels in your body. High insulin can stimulate changes in the skin, making it look darker and thicker. So if you notice dark patch on the neck, especially along with belly fat, cravings, and with a family history of diabetes, please do not ignore it. It does not always mean diabetes, but it is worth to check and rule out. Another sign is difficulty in losing weight even when you're trying. And I know this can be very frustrating because many people think losing weight is about eating less. But when insulin stays high in your body tends to stay in a storage mode. So if you only reduce food drastically, you may feel tired, hungry, and frustrated. So the better approach is not extreme dieting. The best approach is to manage insulin resistance. That will make your cells to respond better to insulin again. Now comment down if you have experienced the next one. Brain fog. During a brain fog, you might feel dull, sleepy, or unable to focus, especially after meals. You know, our brain always prefers a stable energy supply. When your blood sugar and insulin are fluctuating, your focus and mental clarity can also fluctuate. So if you notice that your mind becomes cloudy after meals, especially after carbohydrate-heavy meals, that can be another clue. The next one is very important because most people don't feel it. Insulin resistance is often connected to fatty liver and high triglycerides. You may discover it only during a blood test or an ultrasound. This is because when the body struggles with insulin, fat metabolism also gets affected. So if your doctor has told you that you have fatty liver, high triglycerides, or borderline sugar, don't treat them as separate random problems. They all may be connected to your metabolic health. So those were the 7 signs that your body will show if you are having insulin resistance. Now before we get into what are the tests that you should do to diagnose an insulin resistance, let us look into what actually increases insulin resistance. So insulin resistance is more likely if you have belly fat, low physical activity, long sitting hours, poor sleep, high stress, family history of diabetes, frequent sugary drinks, PCOS, fatty liver, and triglycerides. These factors don't necessarily mean that you have insulin resistance, but having them definitely increase the risk. Now, if you're having the above mentioned conditions, do not panic and don't ignore either. Speak with your doctor and consider to check the following blood parameters such as fasting blood sugar, HbA1c, fasting insulin, lipid profile, liver function, and of course, waist circumference. So before we wind up the video, let us look into 5 things that you can do to better manage insulin resistance. The first one is to walk 10 to 15 minutes after your meal. When your muscles contract during walking, they can take up more glucose from the blood for energy, partially through pathways that do not depend on insulin. It's like opening a second door for glucose entry. The second one is to focus on preserving and building muscle through strength training. Think of your muscles as storage tanks for glucose. The larger and more active your muscle mass, the bigger your body's capacity to handle and clear out glucose efficiently. The third one is, instead of focusing on what you cut out, focus on what you put in. Here, prioritize enough protein and fiber. Protein will keep your hunger hormones quiet, while fiber acts like a net in your digestive tract, slowing down how fast sugar enters your bloodstream. My fourth recommendation is to cut down on refined carbs and liquid sugars such as sodas, sweetened teas, and fruit juices. Because when you eat liquids, there is no fiber to slow things down. As a result, what happens? Sugar hits your bloodstream like a tidal wave, forcing your body to pump out massive amounts of insulin. And lastly, the very important one, protect your sleep and manage your stress. When you are chronically stressed or short on sleep, your body floods your system with cortisol. As you would know, cortisol is a stress hormone that actively increases blood sugar and signals your body to hold on to belly fat, making insulin resistance worse even if your diet is perfect. So always remember that insulin resistance can show up early as belly fat, cravings, tiredness after meals, constant hunger, dark neck patches, fatty liver, and difficulty losing weight. And one of the first steps to improve insulin resistance is to remove excess sugar and refined carbohydrates because they increase insulin demand. I also did a 9 days sugar cut experiment in which I have explained what changed in my body and what happens physiologically when you reduce sugar. So if you're interested, go check that video out here, and I'll see you inside.